Hello, I'm Dr. Shelley Glover with Your Body in Balance, and today I wanted to talk to you about hormone balancing and whether or not it's something for you. Many women and men, as they get older, and it doesn't have to be that old, start to have what we call, for females, perimenopausal symptoms. Men can have their menopausal symptoms, menopausal symptoms, we call them. And they can start as early as in the 30s. However, the majority of my clients are usually in their 40s, 50s, 60s and when they come to discuss hormone balancing. So there's several different benefits that go with hormone balancing, and I don't care whether or not you're actually menopausal completely or not. I want to treat the individual, and I want to make your life as good as it can be. A lot of my clients say, I want to get me back, and I get them there, and that's my goal. Uh, I've been on testosterone pellet therapy for 10 years. I think it's the best thing since sliced cheese. When you're looking at hormonal therapy, what you want is obviously what we think of, which is the alleviation of hot flashes and night sweats, but there's so much more. It helps with sleep, it helps with moods, it helps with energy, it helps with focus. I tell people you'll know where you want to go and how you want to get there. Bar none, testosterone will give you a sex drive. You could take a pink pill, a yellow pill, a green pill. You're never going to get a sex drive like you will with testosterone. It gives you the benefits of testosterone compared to estrogen, progesterone. There's several other hormones out there, but those are our main ones that you hear about. Testosterone actually breaks down into estrogen in your target tissue, so you kind of get two bangs with one buck. And that's what I love about it. And it's also weight neutral to weight losing. You notice that men can be overweight, but when they make up their minds to lose weight, they will actually lose 10 times to the females one time. And that's because of the testosterone building up lean body mass. So testosterone can be great for that, and most of my female patients are not trying to gain weight. It also, because it breaks down into estrogen, you see all of the benefits that estrogen can do in the bladder and also in the vaginal vault. So we see significant improvement in vaginal dryness, in urinary urgency, frequency, and leakage. Also, in if there's pain with intercourse because of vaginal dryness and menopausal changes, you can see significant improvement in that as well. Other things that people don't realize that testosterone does more so than the other hormones is it can work on your memory, it can work on headaches, it actually significantly can improve migraines and joint pain, as well as hair loss. A lot of women think that they're going to develop male pattern baldness. If you do, then I tell people you probably are not seeing the right doctor for your hormone therapy. You can have hair loss when your testosterone levels are extremely low or if they're excessively high. And my goal is to make sure that you're on either end of that spectrum, whether you're a male or a female that I'm treating. So that should not be a concern. And the great thing about hormone replacement therapy, especially if you're utilizing bioidentical hormones, which is what I utilize in my practice, is that it's very tailored. We don't treat everyone the same. We do follow labs. But I don't treat the piece of paper. I'm treating you, the patient. And so, but by taking the blood work, taking your symptoms, and looking at the entire picture, we develop a therapy specifically for you. And then if it's not working the way we want to, we adjust it. That's not it. It's not like if we do testosterone therapy and it's not working for you, well, that's it. You're just going to be miserable the rest of your life. No, 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 no. So there's ideal clients for every single therapy, and we start off with what seems to be the best thing for you based on your comfort level, as well as based on what we're seeing in the blood work and your symptomatology. But then we tweak things until we get a nice, smooth running machine, and then it's usually just golden. So what kind of questions do my clients frequently ask? Why would I do a pellet versus a pill versus a patch? Well, pellets are wonderfully easy. I'm into easy. I'm a little on the lazy side. I don't want to take a pill every single day. I don't want to rub a cream on every single day. That would drive me bananas. And I don't want to have the sticky mess of a cream and all that business. Also, creams, no matter what anybody tells you, are transferable. So don't believe that It's not. I get patients all the time that tell me, "Oh, my doctor said that it doesn't spread to anybody." No, no. If it's on your skin, it can go to somebody else's skin, and so you do have to be careful with that. Pills, the dose changes, and then you're getting into generics versus brand if you're dealing with mainstream. So I just prefer to keep things in a more steady release, which you get with the pellet therapy. Patches aren't bad, but patches you have to once again change. You can get skin irritation, and then once again you're getting into that's even though it can be bioidentical, you're dealing with different generics, and there's variation within that. And so I just prefer the pellet therapy. I think it just works beautifully. The other thing about the pellet therapy is you only have to do some things a couple times a year. So instead of doing something either a couple times a week or every single day, I tell people you give me your hip, I put some pellets in there, and I see you 3 times a year if you're a female, twice a year if you're a male. Other questions. Is there downtime? Uh, when you do it, you're not going to work out for about 2 days because you just had pellets placed into your hip. And if you do extraneous workout, then you could potentially bruise into that area. If you do, then you end up with what I call a big old hemotomato. And instead of the natural swelling process resolving in 1 to 2 weeks, it could actually persist more like 3 to 4 weeks. And trust me, I've done it, and I've lived to regret that. It's not excruciatingly painful, but it's annoying. So as I tell my clients, work out before you come in, and then just plan to take 2 days off to smell the roses. As far as hot tubs, swimming, I prefer that you don't swim or get into hot tubs or baths for about a week. But other than that, we certainly do want you to shower. You do take off the dressing. There's a little steri strips that look like little butterfly closures that you will wear for a week, and then you just take them on off. But that's the great thing. And another question is, do I have to get sewn up? No, we use these little butterfly closures, and you just pull them off in a week, and life is golden. Does it hurt? No, it doesn't. We numb you up. I tell people you have a numb tushy for the rest of the day, but that you do get a little stinging from the actual numbing. But I'm pretty good at it, and most of our clients are like, "Oh, you're done." Actually, all of our new clients are amazed that we're done with the procedure. They're thinking I'm just getting started, and the procedure's done. So it's extremely fast. I tell people it takes longer to set up for than it actually takes to do it. And after the numbing's in, you should feel absolutely nothing. If you do, I stop and I fix it up because I am not into pain. And I am a pellet user myself. I've been on pellets for 10 years, and as I tell people, I will chase my nurse practitioner into the parking lot to get my pellets every 3 months. How often do we get them? That's the next question. It ranges usually, most of my female clients are getting them every 12 to 14 weeks. It's not set in stone. Once again, everybody is individualized. It's based on your system. Whenever you get hormones, no matter how you get them, it's your body and what hormones you're already naturally producing, whatever other medications and supplements and things that you're on, as well as what I'm giving you that is going to make up your unique situation. So we give you guesstimates, we work with you, and then we adjust your therapy as we go along. But in routine, most of our female patients are getting pellets 3 times a year, and most of our male pellets, as I think I mentioned before, get the pellets twice a year. Other questions? Are pellets new? Are pellets alternative? Are they something that somebody just came up with? And are they safe? That's a big one. Are they safe? Pellets were around before estrogen pills were around. Bioidentical hormones are hard to get to stay in their active form. And so pellets were a much easier way to introduce the hormones in the body and have them slowly release and be effective. A lot of people don't realize, but progesterone, natural progesterone, you would have to take it until just about 10 years ago, 5 times a day if you try to take it orally, because it would just get eaten up in the GI tract, and so it wasn't effective, and most of us don't want to sit there and take something 5 times a day. So it's just recently that they've been able to get the hormones into the position where you could actually even take them orally and have them be effective. In Europe, pellet therapy is big, big, big. I have clients that come to me from Europe all the time, and they've been on pellet therapy. I think I have a client that's been on it for 30 years, and that is not uncommon over there at all. I've been on pellet therapy, I think I mentioned, for 10, and I'm still doing quite well. So I will leave it at that. I'm going to just recommend that if you are interested in discussing your hormones with me any further, that you make a call to the office. The phone number is 352-243-6686. That's 352-243-6686. And I would love to speak with you further. Have a great day.